Explore vital insights and coping mechanisms for effectively dealing with anxiety, dementia, and depression, fostering well-being and resilience. This course focuses on the emotional and psychological needs of patients dealing with anxiety, dementia, and depression. CNAs and healthcare workers will gain essential skills and knowledge to provide compassionate care and support for these patients. Anxiety, dementia, and depression are common psychological conditions in healthcare settings, often affecting patients' ability to engage in their care and interact with others. As CNAs, understanding how to identify these conditions, communicate effectively, and provide appropriate support can significantly improve a patient's quality of life. This course covers key concepts, strategies, and techniques to assist patients with anxiety, dementia, and depression while promoting dignity, safety, and emotional well-being. Understanding anxiety, dementia, and depression. Understanding these conditions is crucial for providing appropriate care and ensuring the patient's comfort. Anxiety. Anxiety is a feeling of fear or worry about a perceived threat. It can manifest as restlessness, increased heart rate, and difficulty concentrating. It often results from stress, medical conditions, or environmental changes. Dementia. Dementia is an umbrella term for a variety of conditions that impair cognitive functioning, including memory, communication, and decision-making. Alzheimer's disease is the most common form of dementia, characterized by gradual memory loss and confusion. Depression. Depression is a mental health condition characterized by persistent sadness, loss of interest in activities, and difficulty concentrating. It can lead to physical symptoms such as fatigue, changes in appetite, and difficulty sleeping. Key points. Anxiety often responds to relaxation techniques or cognitive behavioral strategies. Dementia requires structured routines and familiar environments to reduce confusion. Depression may require emotional support, encouragement, and sometimes medical intervention. Recognizing signs and symptoms. Recognizing the signs and symptoms of anxiety, dementia, and depression is crucial for CNAs in providing timely care and support. Signs and symptoms of anxiety: restlessness or nervousness, rapid heart rate or breathing, difficulty concentrating or focusing, complaints of physical symptoms, example, headaches, stomach aches. Signs and symptoms of dementia: memory loss, example, forgetting names, appointments, or locations, difficulty communicating or finding the right words, disorientation to time and place, poor judgment and decision-making skills, behavioral changes such as agitation, aggression, or withdrawal. Signs and symptoms of depression: persistent sadness or empty feelings, loss of interest in activities once enjoyed, changes in appetite or sleep patterns, difficulty focusing or making decisions, physical symptoms like fatigue or aches without clear cause. By observing these signs, CNAs can intervene early and ensure appropriate care for patients struggling with anxiety, dementia, or depression. Effective communication strategies for anxiety, dementia, and depression. Effective communication is key to providing emotional support for patients experiencing anxiety, dementia, or depression. Adapting communication strategies based on the patient's condition will reduce stress and create a more supportive environment. For anxiety, use calm, reassuring tones. Speak slowly and offer reassurance. Help the patient focus on their breathing. Encourage deep breathing exercises. Deep breathing can help regulate the patient's physical symptoms and reduce panic. Validate feelings. Acknowledge the patient's anxiety and avoid dismissing their concerns. Keep instructions simple. Give short, clear instructions and avoid overwhelming the patient. For dementia, use simple, clear language. Patients with dementia may have difficulty processing complex information. Use short sentences and clear instructions. Avoid correcting the patient. Correcting them can cause frustration. Instead, gently redirect or offer reassurance. Provide familiar cues. Maintain routines, use familiar names or objects, and ensure the patient feels comfortable and safe. Be patient and allow extra time. Give the patient time to process information and respond. For depression, offer a listening ear. Sometimes the patient just needs someone to talk to. Let them express their feelings without judgment. Encourage small steps. Help the patient set small, achievable goals for their day, such as getting out of bed or eating a meal. Avoid offering unsolicited advice. Simply offering a comforting presence is often more helpful than trying to fix the situation. Providing comfort and reassurance to anxious patients. Anxiety can be debilitating for patients, affecting both their physical and mental health. Providing comfort and reassurance is essential to helping the patient feel supported and secure. Techniques for reassurance. Calm presence. Your presence alone can provide comfort. Remain calm and composed to model a sense of control. Redirect attention. Help the patient focus on something calming, like a soothing image or a favorite object. Breathing exercises. Encourage slow, deep breaths to help the patient calm down. You can guide them through the steps or simply demonstrate. Distraction. Engage the patient in light conversation, music, or a favorite hobby to shift their focus from anxiety-provoking thoughts. Caring for patients with dementia, techniques for safety and engagement. Patients with dementia face challenges with memory, cognition, and behavior, making it essential to maintain a structured, safe environment that supports their needs. Techniques for supporting dementia patients. Routine and structure. A consistent routine helps reduce confusion and anxiety. Ensure regular meal times, medication schedules, and sleep routines. Safety modifications. Ensure the environment is free of obstacles or hazards. Use safety devices like bed alarms to prevent wandering. Engagement. Encourage activities that engage the patient's cognitive abilities, such as puzzles, memory games, or reminiscing about past events. Monitor behavior. Be aware of mood changes, such as agitation or aggression, and have strategies to address these behaviors safely. Supporting patients with depression. Emotional and practical care. Depression can deeply affect a patient's mental and physical health, making it harder for them to care for themselves or find joy in life. Providing emotional and practical support is crucial. Supporting depression. Listen and validate. Offer a listening ear and let the patient express their feelings without judgment. Acknowledge their emotions and provide reassurance. Encourage self-care. Encourage basic activities such as personal hygiene, eating, or getting out of bed. Set small, manageable goals. Assist with daily tasks. Offer help with ADLs, dressing, feeding, etc., but encourage the patient to do as much as possible independently. Monitor for suicidal ideation. Be vigilant for signs of depression that may indicate suicidal thoughts. If the patient shows signs of suicidal ideation, immediately inform the nursing staff. Ethical considerations and cultural sensitivity in mental health care. Dealing with patients who have anxiety, dementia, or depression requires not only medical knowledge, but also sensitivity to the ethical and cultural aspects of care. Key ethical considerations. Autonomy. Respect the patient's right to make decisions about their care, even if their choices differ from what healthcare providers would recommend. Confidentiality. Maintain the patient's privacy, especially when discussing sensitive mental health information. Informed consent. Ensure that patients with mental health conditions understand their care options and are involved in decisions. Cultural sensitivity. Understand cultural differences. Be aware that patients from different cultural backgrounds may have different views on mental health and treatment. Respect their beliefs and preferences. Tailor care to individual needs. Adapt care strategies based on the patient's cultural and personal preferences, ensuring they feel comfortable and respected. CNA responsibilities in managing anxiety, dementia, and depression. As a CNA, your role includes providing direct care, reporting observations, and ensuring the emotional and psychological well-being of the patient. Key CNA responsibilities. Observation. Monitor patients for signs of anxiety, dementia, and depression. Report any significant changes in their behavior or mental state. Provide support. Offer emotional comfort, encouragement, and assistance with ADLs. Help patients feel safe, heard, and supported. Document care. Accurately document any emotional or psychological care interventions, noting changes in the patient's condition and any strategies used to manage their symptoms. Advocate for the patient. Be an advocate for the patient's needs, ensuring their emotional well-being is considered in the overall care plan.